Hi everyone, welcome to our debate. My name is Drew Fitzpatrick and my partner is Jessica Noormets. We're going to be debating the topic of smoking and whether or not non-smokers should be prioritised over smokers on hospital waiting lists. I'm going to be arguing for the positive side that non-smokers should get priority in regards to public healthcare, and Jess will be on the negative side as she believes that all Australians should have equal access to public healthcare when they're in need of it. I strongly agree with our topic statement. Non-smokers should always be prioritised on hospital waiting lists, especially when it comes to organ transplants. If a smoker is in need of a new healthy organ, it is most likely because of an illness or disease that has been caused by their decision to smoke, unlike a patient who does not smoke. It is well known in Australia that smoking causes a vast array of potentially fatal health problems. If people choose to smoke, they are accepting the risk of falling victim to the problems that come with it. Problems that include multiple forms of cancer, heart disease, and chronic pulmonary disease. In our research, we found that smoking kills an estimated 15,000 Australians a year, and smoking also resulted in 750,000 days spent in hospital a year. It also cost the Australian government $31.5 billion in social, health, and economic costs. Smoking is a burden on this country. People who smoke see all of the ads and graphic pictures on the packets that they buy every day. They know exactly what the habit causes and still willingly choose to smoke. Therefore, those who choose to look after themselves and are health conscious should receive the healthcare that they need before smokers, as they will have become ill at random and through no fault of their own. The healthcare system in Australia is already strained as it is, and so many people are in need and have to wait for months and sometimes even years for the surgeries and healthcare that they need. The government constantly has to cut funding for health, which is just going to keep making it harder for people to access what they need. People who smoke are jeopardising others accessing public healthcare. I truly believe that that is unfair, not only to the people waiting, but also to the healthcare professionals who have spent so many years and so much money in education and dedicate their lives to helping people. Smokers are addicts, and it is highly likely that a smoker will go home after life-saving surgery or treatment for a health problem caused by their smoking and will continue to do so, which is just a big slap in the face to all of the doctors and nurses who work to help them, and also the non-smokers who are sick and would do anything to get better.
How is that different from alcoholics? I strongly disagree with what you present. Although alcohol and cigarettes give off different toxins to the body, they both have similar effects on it. While cigarettes produce nicotine and alcohol produces MECHO, which is another harmful chemical to the body, both toxins can cause very similar effects. Alcohol increases your blood pressure, the risk of diabetes, and the rate of heart attack. In addition, smoking also increases heart rate and the blood pressure, while expanding the chance of a heart attack and possible stroke. Alcohol can cause coronary heart disease, which can be enhanced by the smoking effect of decreased lung function and the constriction of blood vessels. Smoking and alcohol are proven to cause some type of cancers. But how would we know what substances cause the cancer if a patient was admitted to hospital? Both alcohol and smoking have negative effects on the body and are known to have a relationship between one another. During my research, I found that approximately 150,000 men and women are admitted into hospital each year due to alcohol poisoning. Of that amount, 15 Australians die each day, which eventually adds up to being 5,550 people per year. That's alcohol itself, let alone those who die of diseases or stroke. These statistics are proven higher than those patients admitted into hospital due to smoking. Alcohol and smoking are both substances referred to as drugs. However, what about junk food? That can be just as addicting and can eventually lead to being hospitalised or even worse, death. The reason why patients are in hospital may not be because of smoking. Many patients are put in hospital due to other reasons. Everyone is different, including their DNA and genetics. People who smoke may have an illness or a disease that is genetic. That is, it might not be because of smoking. Therefore, judging people on whether or not they smoke can be irrelevant to the condition of their health. You simply cannot deny healthcare to smokers purely because of something they chose. Even though they smoke, they are still humans, and prioritising non-smokers over smokers is treating them as if they are slightly less, which isn't good enough. We as human beings need to stick together to improve every single person's quality of life. Hospitals are open to the general public to assist in things or issues that need special attention, which such problems can occur to anyone, no matter what race, lifestyle, or age. So why should smokers be penalised because of the negative effects on the body when alcohol and junk food can have the same, if not similar, effects?
I have found that smoking causes more deaths than road accidents, alcohol, and drug-related deaths combined. Deaths from tobacco use caused 89% of all drug-related deaths and 11% of deaths from all causes. It also amounts to far more time spent in a hospital than alcohol-related incidents. The pressure that smoking puts on Australia's healthcare and the financial burden it causes is unacceptable. As I said, smoking is a choice, and the risks of doing so are so high, and the effects on your health are so drastic, that quitting will have nearly immediate benefits and will dramatically reduce your risk of smoking-related diseases. For example, quitting before 30 years of age will reduce your risk of lung cancer by 90%. After 15 years of being a non-smoker, your risk of stroke is that of someone who has never smoked. And within 2 years of quitting, the risk of heart attack will dramatically decrease. All of this proves how damaging smoking is and how much of a poor decision it is to be a smoker. If after knowing all this, you still smoke cigarettes, I believe you should give up the right to immediate health care, when there are others who don't smoke waiting for health care for illnesses they have been randomly and unluckily diagnosed with naturally, and not through subjecting themselves to something that causes such horrific diseases. An Australian Institute of Health and Welfare study found tobacco had the greatest disease burden, 7.8% in total. Alcohol was responsible for a much smaller portion of disease burden than tobacco, 3.3% of the total. Smoking is one of the highest causes of death and poor health in Australia. It causes much higher rates of death and time spent in hospital than most other things. It puts massive pressure on Australia, financially, and on our healthcare system. I think we are very lucky in this country as we have one of the best healthcare systems in the world. Smokers are taking this for granted. And if the trend of them having to be admitted into hospital at such high numbers continues, or if it gets even worse, it is not going to last for long. All in all, this is why I believe that non-smokers should be prioritised on hospital waiting lists over smokers.
Did you know that smoking is not actually illegal? Although smoking may produce harmful toxins to the body, it is not actually against the law. However, there is a legal age of which it is acceptable to purchase a pack of cigarettes. In Australia, this age is 18. Even though smoking is not illegal, it is still frowned upon by society. People are still being punished and judged based on a lifestyle choice. Smokers are feeling victimised for something that is completely legal. This is then causing a divide between people in society, of which there has already been a divide between smokers and non-smokers. This refers to health insurance, healthcare, Medicare, anything like that. This is also lessening the health benefits for smokers and is becoming quite unfair. Even venues are encouraging divides between smokers and non-smokers when designating rooms to one another. This is further encouraging non-smokers to not socialise with smokers. So why is it fair to prioritise non-smokers when smokers already have less benefits when it comes to healthcare? Prioritising in hospitals could lead to thousands of people becoming or remaining ill to simple things that can be prevented. This could then lead to further issues which could potentially increase costs of hospitals and eventually spending more money than we already have. If all humans are treated the same in hospitals, this could minimise and fix simple problems, and it can reduce the costs and prolong time. This is why I believe that smokers should not be prioritised over non-smokers in hospital. In summary, Drew believes non-smokers should be prioritised on hospital waiting lists due to the known dangers of smoking and the burden it puts on Australians' healthcare. Whereas I disagree, because everyone is human, therefore has a right to access the Australian healthcare system, and also because smoking is legal and there are so many other substances that have a similar effect.
Thank you all so much for watching our debate. I hope that we've broadened your knowledge on smoking related health issues and our related opinions. Thank you.